All right, so post-operative pulmonary complications. Which clients are at the highest risk? Which do you think? Elderly, immobile, okay, patients with contractures and things along those lines, those that aren't getting up and moving after surgery. It used to be, back in the day, remember we talked about HAIs, healthcare associated infections and things, okay, nosocomial infections. It used to be, oh well, if you're going to go in for surgery, you're going to be in the hospital for a long time because you're going to get pneumonia and all these other complications. But by doing, again, nursing-driven research as well, getting patients up and out of bed, even if they don't want to, okay, it's more beneficial for them. I cannot tell you how many times I'm like, well, if you want to be here longer, you can stay in bed. 9 times out of 10, they're like, oh, what do I need to do to get the hell out of here? I cannot tell you. As a healthcare worker, I don't like being in the hospital unless I'm getting paid, and even then, that's questionable. Okay? So it depends on who I'm working with. All right. Atelectasis is the fancy term for. Wow, I didn't know that meant crickets. Atelectasis is the fancy term for a collapsed lung. Okay, or a portion or a lobe of the lung. All right. And what do we do for patients who are at risk for these things? Again, we're going to go into the IS at least 10 times an hour while awake. We're going to do turning and cough deep breathing. So not just to check for hernias anymore, guys, okay? We need to make sure that even if they had abdominal surgery. Now, I had my appendix taken out and I felt like a Macy's Day float. And I did not want to turn, I didn't want to move, I didn't want to do anything. But what can we do to patients who have had an incision in this area that they're going to have pressure on when they cough? We're going to splint it. Give them a pillow, whether it's a large one or a small one, have them put it up against their incision, and as they cough, tell them to give them a nice little to kind of give it support. So that way, because when you cough and you increase that intra-abdominal pressure, on the inside, it's actually going like this. And that's what causes the discomfort. So if we kind of splint it and hold it there in place, it's not going to give that option for that to happen. And, okay. I'm going to do oral care at least twice a day on these patients. Again, human mouth is disgusting. If they inhale anything or aspirate anything like that into their lungs, aspiration pneumonia. Okay? Keep the head of the bed at least 30 or more degrees. Okay, again, that's going to help with what's called postural drainage and pulmonary toileting. Okay? Get them up and ambulate unless it's contraindicated. Okay, unless they are ordered on strict bed rest, they should be getting up at least 2 to 3 times a day. Okay, they might not have to get up and ambulate around the hall 2 or 3 times a day, maybe just once a day, however they're tolerating it, but don't let them sit in the bed all day. Get them up and into a chair, into the wheelchair, whatever. Okay, out of bed for meals or sit up at the bedside for meals. So have them dangle over, get up out of that position of the bed, have them dangle their legs over the side, bring the over the bed table to them, put their meal in front of them, have them sit up for that duration. Okay? Reposition at least every 2 hours, and of course encourage those fluids to thin out those secretions. Okay? Almost done. Okay? Hypoxemia, low blood oxygen. Okay? There's a couple of things here that you definitely need to remember. Oops. Rat bed. I know that I typed that in to find a picture, and I did not realize that that was actually a thing. They make little rat beds for your pet rat and little rat hammocks. I was like, wow, okay. Some people have way too much free time. Okay? But early symptoms of hypoxemia is going to be restlessness, anxious, and they're going to be tachypnic. That respiratory rate is going to go up above 22. Okay? Because they're freaking out because they can't breathe. And so they're gonna breathe a lot faster. Okay, they might be a little bit on the paler side, that's the pallor. Might have some accessory muscle use, nasal flaring. But then when we get to late symptoms, it kind of changes in that they're going to become bradycardic. The body's starting to shut down because of lack of oxygen. Okay? They are going to get even more restless, or they might have what's called a sense of impending doom. I'm sure you've seen that in your textbook a couple of times. Okay? The feeling of, I feel like I'm gonna die. Okay? That's a late response. Dysrhythmias with their cardiac rhythm. Their cardiac rhythm is going to go all over the place. All right. You will learn, I believe you guys start learning cardiac rhythms next semester, in semester 6. Okay. And then they'll become dyspneic, having a really hard time breathing. It might be painful or just difficult for them to do that. Okay. Now, as far as health promotion, we talked about tobacco use. Here in Arizona, we actually have a fantastic resource to help people quit smoking. It's called the Arizona Ash Line. Have you guys heard of this? Yeah. They will hook you, they helped my mom quit smoking, because I had to quit after my heart attack, and then she quit, because I was like, damn, you stink when you go outside for a cigarette. I did not realize that that's what I smelled like when I was smoking. Okay? But they get you in touch with any type of supply that you need, whether it's nicotine patches, nicotine gum, a support person, so it's almost like AA, but for smokers. And they have this phone number here that you can call when if you're, I want to have a cigarette, but, I'm trying to quit, I need to, They have people there that have been through it and can help talk you through a craving situation, okay? We often don't think about secondhand smoke either. And now there's a thing, apparently, third-hand smoke. Have you guys heard of this? No. So if you were to purchase a car from somebody who smoked, and maybe they quit smoking or whatnot, and they just couldn't, handle the car anymore or whatever, and you get into the car, and granted they haven't smoked in probably maybe a year or so, you are now being exposed to third-hand smoke. Because it's still within the upholstery of the car and stuff. I was like, dang, that's okay. It's a little bit much for me, but okay. Okay. There are other resources out there as well. There's a lot of different programs and things, incentive programs. I think even at my last teaching job at MCC, they had a thing where it was a whole health journey thing over the course of a year. You know, quit smoking, if you lost weight, that you got like extra cash at the end of the year, which was always nice. Respiratory immunizations, we really already talked about those as far as the need for those. Now, I will say, the influenza vaccine is available every year, okay? Now, a lot of misconceptions about this, okay? Just because you get the flu vaccine, does that mean you will not get the flu? No. No. It is comprised of a vaccine for the 10 most likely flu infections that we might be exposed to in the coming year. Because we actually follow the same type of schedule that Australia does. So whenever they have a high indication of a certain type of microbe related to flu, we also tend to get that same one. Okay, and that's how, and they have these built out like 2 or 3 years out in advance. The pneumonia vaccine, though, how many times can people get that one? Dos. Once at the age of 65, and preferably one more about 5 years later, or within the next 5 years after that first one. Okay, after that they should be golden. Should be. And this is just a nice little, if it's going to catch up with me here. Come on now. For the love of it. At least it waited till the end. But a lot of stuff with respirations and oxygenation here. We're going to make sure to assess for respirations, assess their oxygen saturation, their physiology. Are they ventilating well? Okay, are they able to actually breathe and have that gas exchange? I go into this a little bit more with gas exchange and perfusion, or oxygenation and perfusion later on. But you guys, everyone here is familiar with The Wizard of Oz?
Yes.
Okay. Did you know that one of the original actors in that movie almost died?
The Tin Man.
The Tin Man. Why?
They were using the stuff to paint his face, and it was like he was inhaling it.
Yeah, it was aluminum powder.
And it coated his lungs where there was no like O2 exchange because it was just.
It was covered in the makeup.
Yeah.
And he almost died, and they had to put him in an iron lung, and he did live, thank